Hi, everybody. Our presentation today is on bipolar disorder. Our group members' names are Lindsay Brond, Emily Gregorick, Jacqueline Serene McMillan, and Sarah Packard and Denise Ferguson. So let's get started. So just a little background information to start. Approximately 8% of adults will experience major depression at some time in their lives. Approximately 1% of Canadians will experience bipolar disorder. The economic cost of mental illness in Canada on the healthcare system in 1989 was at $7.9 billion per year. $4.7 billion was spent on care for the mentally ill, and $3.2 billion was spent on disability and early death. Because of the high rate of mood disorders have a major effect on Canadian economy. This effect is caused by two major issues: the loss of productivity in the workplace due to absenteeism and diminished effectiveness. The second reason is due to the high healthcare costs that are caused by primary care costs, hospitalization, and medication. When someone is diagnosed with a mental illness, this can affect the family as a whole. The loss of income and the increased cost of medication can put an additional strain on the family's financial resources. Bipolar disorder often develops in a person's late teens or early adult years. At least half of all cases start before the age of 25. Some people have their first symptoms during childhood, while others may develop late in life. What is bipolar disorder? Bipolar disorder is also called manic depressive illness. It is a brain disorder that causes changes in mood, energy, activity levels, and the ability to carry out day-to-day tasks. The shifts in mood that are associated with bipolar disorder is different from the ups and downs that everyone goes through. Bipolar disorder can result in relationships being damaged, poor job or school performance, and even suicide. Bipolar disorder can be treated, and people living with this disorder can lead full and productive lives. Often, the symptoms appear late in the late teen years or early adult years. Half of all cases occur before the age of 25, although some have symptoms that appear during late childhood, while others may develop symptoms late in life. Bipolar disorder is not an easy diagnosis. Some people suffer for years before they are diagnosed. Bipolar disorder in the media. Bipolar disorder is depicted in a TV show, Homeland. In this show, the main character, Carrie, is a very intelligent CIA agent that has been diagnosed with bipolar disorder. At the beginning of the series, the audience becomes aware of her mental illness. However, at this point, it is not illuminated as the central plot. Her employers are not aware that she has bipolar disorder, and it is not until halfway through the series that it becomes the main focus of the show. She obtains lithium to treat her bipolar disorder from her sister, who is a psychiatrist, rather than seeking treatment somewhere else. This may not be a realistic scenario, but after all, it is television. However, it does not depict the negative perceptions of mental illness in the workplace. She hesitates to tell coworkers that she has bipolar disorder because she does not want to appear weak or incompetent, since she is in a position of leadership. At one point in the show, she discontinues her medication without consultation because she thinks that it has an impact on her ability to concentrate. Instead, she tries other methods to treat her illness, which include exercise, healthier diet, etc. It is not long after she returns back to her meds when she realizes being off her medication is doing more harm than good. In the final episodes, trauma triggers a manic episode, which is characterized by rapid thoughts and a surplus of ideas. She ends up in the hospital, but eventually this period actually enables a breakthrough in her work. An example of an unrealistic scenario in the show would be when Carrie is inexplicitly given electroconvulsive therapy, ECT, in one of the final episodes. Realistically, ECT is only used when all other treatment methods have failed. Carrie previously responded well to the medication, so ECT would only be used if the medication was no longer effective. However, it is extremely effective intervention for some people. She is always seen as being in control of her own treatment, which is a good thing. Homeland would most likely have more of a positive influence on stigma. It educates the public more on the mental illness because it sends a message that people can have bipolar disorder and still function properly. Oftentimes, mental illnesses are portrayed negatively in the media. Individuals who are mentally ill are seen as dangerous, violent, or unpredictable, when really, realistically, it is not the case. However, this show portrays bipolar quite accurately. It is not 100% perfect after all. Television is always dramatized. Overall, bipolar disorder is represented appropriately in the show Homeland, and it appears to be among the better forms of media that focuses on the portrayal of mental illnesses. Diagnosis. When doctors think a patient may be suffering from bipolar disorder, there are a number of tests and exams that are done to ensure that they really have the disorder. These tests can help to rule out other problems, pinpoint a diagnosis, and also check for any related complications. Some of the tests that are involved are a physical exam. This is done to identify any medical problems that can cause your symptoms. Psychological evaluation, talking to the patient about their thoughts, feelings, behavior patterns, etc. The health professional may also get the patient to fill out a psychological assessment or questionnaire. With permission from the patient, the healthcare provider may also ask family members and/or close friends to sit in on this matter to provide more information about the symptoms that are occurring and if there are possible episodes of mania or depression that are also going on. Mood charting. This is where the patient is asked to write down changes in mood, sleep patterns, or other factors that could help with the diagnosis and treatment possibilities. Signs and symptoms. The doctor or mental health professional will compare symptoms that the patient is showing with a specific set of criteria for bipolar and other health-related disorders in the Diagnostic and Statistical Manual for Mental Health Disorders or determining a diagnosis. Characteristics or symptoms of bipolar disorder. Bipolar disorder has a wide range of symptoms. Symptoms range from mild hypomania and depression to severe mania and depression, which are accompanied by profound psychosis. Primary symptoms of the disorder are dramatic and unpredictable mood swings. There are several types of disorders, which all include symptoms of depression, mania, and to a degree. According to the criteria of the American Psychiatric Association, a manic episode is a specific period of abnormally and persistently elevated, expansive, or irritable mood. Mania symptoms include excessive happiness, excitement, irritability, restlessness, increased energy levels, less need for sleep, racing thoughts, high sex drive, and a tendency to make big and unattainable plans. During a manic phase, abnormal behavior disrupts life, and some patients may have a total break from reality. Hypomania is also a high energy state in which the patient feels exuberated but hasn't lost their grip on reality. Therefore, the mood disturbances that are not severe enough to cause a prominent impairment in social or occupational functioning. A hypomanic episode period will last at least 4 consecutive days. Depression is a mood disorder that causes a persistent feeling of sadness or loss of interest, also called major depression. Major depressive disorder or clinical depression, it affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and depression may make you feel as if life isn't worth living. Symptoms of depression that a bipolar patient may experience are sadness, anxiety, irritability, loss of energy, uncontrollable crying, change in appetite, which can cause weight loss or gain, increased need for sleep, difficulty making decisions, and thoughts of death or suicide. A major depressive episode will last at least 2 weeks and consist of a depressed mood or loss of interest or pleasure in almost everything. Not all people who have bipolar disorder are going to have the same symptoms. Some people experience mood changes that are less severe than others. Symptoms of mania or manic episode. Mood changes. They can go through a long period of feeling high or an overly happy or outgoing mood. They can also be extremely irritable. The behavior changes: talk fast, jumping from one idea to another and having racing thoughts, being easily distracted, increasing activities such as taking on new projects, being overly restless, sleeping little, having an unrealistic belief of one's ability, and having impulsively or engaging in pleasurable high-risk behaviors. Symptoms of a depression or depressive disorder. Mood changes. They can feel sad for a very long time. They have lots of interest in activities that they once enjoyed. That can include sex. The behavior changes that they go through. They can feel really tired or very slow, having problems concentrating and remembering tasks that they had to do, being restless or irritable. They're changing in eating patterns. They may not want to eat, and they may not want to sleep, or they may sleep a lot. They may also think of death or suicide. Types of bipolar disorder. So there are 4 types of bipolar disorder that we're going to talk about today. The first one is bipolar 1. This is a recurrent mood disorder which features either one or more manic mixed episodes or both manic and mixed episodes with at least one major depressive episode. Bipolar 2 is similar to bipolar 1, other than the mood cycles go from being high and low over time. However, with bipolar 2, the up moods never reach full-on mania, and one or more episodes of major depression occur with at least one hypomanic episode. The third one is rapid cycling. When a person with bipolar disorder experiences 4 or more episodes of mania or depression in a year, it is severe and difficult to treat, and approximately 10 to 20% of those suffering from bipolar disease will experience rapid cycling, which mostly arises in women. The final one is mixed bipolar, when a person will experience both mania and depression simultaneously or in a rapid sequence that lasts at least 1 week. Causes of bipolar disorder. So there's more causes than what we are listing here, but we're just going to talk about a few. So genetics is one. So bipolar disorder tends to run in families. There are some research that indicates that there's a particular gene that may lead to the development of bipolar disorder, and many people who have parents or siblings who have bipolar disorder develop the disorder themselves. The risk increases by 2 to 3-fold for first relatives. Brain structure and functioning. Imaging done on brains of people who have bipolar disorder show that the brains actually look and function differently. One study done using an MRI found that the pattern of brain development in children with bipolar disorder was similar to that in children who have multidimensional impairment. This is a disorder that causes symptoms that overlap somewhat with bipolar disorder and schizophrenia. This shows us that there may be a more common developed brain pattern that is associated with unstable moods. Neurochemical factors. Bipolar disorder is primarily a biological disorder that occurs in a specific area of the brain and is due to the dysfunction of certain neurotransmitters or chemical messengers in the brain. These chemicals may involve neurotransmitters like norepinephrine, serotonin, and probably many others. As a biological disorder, it may lie dormant or be activated on its own, or it may be triggered by external factors such as psychological stress or social circumstances. Reduced level of biomarkers indicate neurological density and variability, decreased neuronal and glial density in the prefrontal cortex, dysregulation of neurotransmitters, serotonin, norepinephrine, dopamine, gamma aminobutyric acid, GABA, dysregulation of second messenger inositol, dysregulation of mood disorders. Environmental factors. A life event may trigger a mood episode in a person with genetic disposition for bipolar disorder. Even without clear genetic factors, altered health habits, alcohol or drug abuse, or hormonal problems can trigger an episode. Among those at risk for the illness, bipolar disorders appearing at increasingly early ages. This apparent increase in earlier occurrence may be due to the underdiagnosis of the disorder in the past. This change in the age of onset may be a result of social and environmental factors that are not yet understood. Although substance abuse is not considered a cause of bipolar disorder, it can worsen the illness by interfering with recovery. Use of alcohol or tranquilizers may induce a more severe depressive phase. Substance abuse is very common among people with bipolar disorder, but the reason for this link is unclear. Some people with bipolar disorder may eat to treat their symptoms with alcohol or drugs. However, substance abuse may trigger or prolong bipolar symptoms, and the behavioral control problems associated with mania can result in a person to drink too much. Anxiety disorders, such as post-traumatic stress disorder, or PTSD, and social phobia, also co-occur often among people with the disorder. Bipolar disorder can occur with attention deficit hyperactive disorder, ADHD, which has some symptoms that overlap with bipolar disorder, such as restlessness and being easily distracted. People with bipolar disorder are also at higher risk for thyroid disease, migraine headaches, heart disease, diabetes, obesity, and other physical illnesses. These illnesses may cause symptoms of mania or depression. They may also result from treatment for bipolar disorder. In people with genetic predisposition, environmental triggers exacerbate or bring on episodes. Factors such as stress, frequent alcohol use, frequent use of stimulants, lack of sleep, hormonal dysregulation. So just to summarize all of that, since there are no specific cause, it is thought to be due to a complex gene interaction and or environmental influences that increase the prevalence of bipolar symptoms. This is why it is so important, if you have a genetic predisposition, to take care of yourself and monitor any known factors. This is true not only for bipolar disorders, but for most disorders. So here we're going to talk about some treatment options that we found. So bipolar disorder cannot be cured, but it can be treated effectively over a long-term care. Proper treatments helps many people with bipolar disorder, even those with the most severe forms of the illness. Gain better control on your mood swings and related symptoms. But because it is a lifelong illness, long-term continuous treatment is needed to control symptoms. However, with proper treatment, mood changes can occur. In the NIMH-funded Systematic Treatment Enhancement Program for Bipolar Disorder, the largest treatment study ever conducted for bipolar disorder, almost half of those recovered still with lingering symptoms. Having another mental disorder in addition to bipolar disorder increases one's chances for a relapse. There are many types of treatment options that are available to aid people in preventing mood swings. Working with your doctor to find out what treatment will work best for you is very important. So some medications that can be used. Not everyone responds to medications in the same way. You're going to need to try several different types of medications before finding one that works best for you. Keeping a daily life chart that makes note of your daily mood swings, treatments, sleep patterns, and life events can help you and your doctor track and treat your illness more effectively. If your symptoms change or if side effects become intolerable, your treatment options may change. However, taking only antidepressants can increase your risk for switching to mania or hypomania or developing rapid cycling symptoms. To prevent this switch, doctors usually require you to take a mood-stabilizing medication at the same time as your antidepressant. Psychotherapy. When done in combination with medication, psychotherapy can be effective treatment for bipolar disorder. It can provide support, education, and guidance to people with bipolar disorder and their families. Some types of psychotherapy treatments that are used to treat bipolar disorder include cognitive behavioral therapy, family-focused therapy, interpersonal and social rhythm therapy, and psychoeducation. Electroconvulsive therapy, ECT, is also another type of treatment. For cases in which medication does not work, ETC may be useful. ECT, formerly known as shock therapy, once had a bad reputation, but in recent years it has greatly improved and can provide relief for people with severe bipolar disorder who are not able to recover with other treatments. Before ECT is administered, a patient takes a muscle relaxant and is put under brief anesthesia. He or she does not consciously feel the electrical impulse administered. And on average, ECT treatments last from 30 to 90 seconds. People who have ECT usually recover after 5 to 15 minutes and are able to go home the same day. Sometimes ECT is used for bipolar symptoms when other medical medications, including ECT is used when other medical conditions, including pregnancy, and the use of other medications is too risky. ECT is a highly effective treatment for severely depressive, manic, or mixed episodes, but is generally not used as a first-line treatment. ECT may cause short-term side effects, including confusion, disorientation, and memory loss. People with bipolar disorder should discuss possible benefits and risks of ECT with an experienced doctor. Some other treatment medications that are used are some sleep medications that can just calm the person down if they're having issues sleeping, and some herbal supplements. But you don't want to just use a herbal supplement without consulting your doctor first. So here is just a chart explaining the different types of treatments and why it helps. So some dopamine, so we'll just talk about a few. So dopamine is an antipsychotic agent, blocks dopamine D2 receptors and potentially anti-maniacs. So it's just going to keep you calm by taking that, what dopamine does. Drug adherence. Psychoeducational treatments improve adherence to mood stabilizers, leading to lower likelihood of a manic reoccurrence. So next we're going to talk about some studies that we found. So the first study, the purpose was to compare the efficacy of CBT in conjunction with treatment as usual. They didn't have a hypothesis, and some sample characteristics. 253 who were later randomized into two groups. So there's 253 people who were randomized into two groups. The group one had treatment as usual, so whatever treatment that they took. And then the second group also had their treatment plus CBT. The findings were, though there was no control group without the disorder, would have been useful to see whether response was seen on people without the disorder as well. They also noticed overall females took more part than males, which is very usual. Overall, the number and gender was distributed evenly, and the even dropout rates, however, gender final numbers were omitted. The inclusion criteria was the people had to be over 18 years, DSM-IV bipolar diagnosis, so they had to be diagnosed with bipolar disorder. They had to have 2 or more episodes of mania or depression within the last 12 months. They have contact with a mental health service within the last 12 months. The exclusion criteria, rapid cycling bipolar disorder, bipolar secondary or organic cause, suicidal identification in the past 3 months, borderline personality disorder, continuous illicit substance abuse, intercurrent manic episode, currently doing other psychological treatment or bipolar symptoms, unable to read or write English, and unable or unwilling to give informed consent. The downfall of this is because participants have had contact with services that may be attributed to regular visits and well-managed symptoms. So the randomized criteria was the number of episodes and current mental states. The outcomes, the primary outcome was time to reoccurrence of episode, longitudinal severity rating of weekly overall symptom levels, and the total cost. The secondary was social adjustment and quality of life. Some of the critiques that we noticed were different research assistant conducted baseline interviews, interviewing subjectivity into assessments, and using total cost as a primary outcome is extremely vague and is not explained in the methodology. The analysis was greater than 0.05. Proportional hazards regression model, Kaplan-Meier reoccurrence-free curves, and an analysis of any mania, depressive episode, and reoccurrence. The next one, cognitive behavioral therapy interventions. The goals were to facilitate disorder acceptance, help patient recognize the need for help, reduce mood variability, and manage stressors and interpersonal issues. There was 22 total sessions. They used the Beck model, gradually tapering off, and 2 review sessions near the end of the intervention. The results were that CBT was more useful to those with fewer than 12 episodes, making it more useful for an early intervention, and over half of patients with a recurrence by the end of the study with no significant differences between the groups. So to conclude, we just wanted to give a little bit of information for if people, somebody who has bipolar disorder, or possibly you might be going through it yourself, just some people that you can contact to talk to. So for one, you can obviously call your doctor, and he or she will definitely help you. But you can also call 911 or go to a hospital emergency room to get immediate help, or ask a friend or family member to help you do these things. There's a 24-hour National Suicide Prevention Lifeline, and that's the number that you can call. Or you can talk to a trained counselor at the number there, and then you can make sure that if you have a friend who's going through this, make sure that you do not leave a suicidal person alone. Talk to them, get them some help. There's definitely a lot of ways that we can make sure that these people are not left alone. So that's the end of our presentation. I hope that you liked it, and have a great day.